By listening to this podcast, you agree to not use this podcast as medical advice to treat any medical condition in yourself or others, including, but not limited to, patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast. Under no circumstances shall any guests or contributors to the podcast or any employees, associates, or affiliates of the Neuroendocrine Cancer Awareness Network be responsible for damages arising from use of this podcast. Welcome, everybody, to another episode of Nets Get Real with NCAN. I am your host, Mike Wayman. And before we get into this week's awesome guest, I do want to let everybody know that our next patient conference will be in Cleveland, Ohio at the DoubleTree, downtown Cleveland. It is going to be on September 9th. We've got 5 awesome doctors lined up. We're going to have the usual Q&A sessions. We're going to have the patient panels, which have been doing really, really well and become really, really fascinating. So if you want, registration is open. Go over to netcancerawareness.org. That's where you can register, sign up to join us for that awesome event. And speaking of that awesome event, we have the director of neuroendocrine tumors, the program at University Hospital out in Cleveland, Ohio. Ladies and gentlemen, Dr. Amr Mohamed. How are you, sir?
Hey, Mike. How are you doing? It's a pleasure to be with you.
Yeah. We're really excited. We're actually really excited for the event. Really happy that you're going to be. You're kind of the anchor to the event. You're the guy. You're the feet on the street out there. So we're excited to have you.
No, I can tell you, all the patients here are really excited about this program, and we're really eagerly waiting for it. Perfect.
Yeah, it's going to be great. We have, like I said, 5 awesome doctors, and the Q&As are always really, really informative, and also, an opportunity to be entertained, because you got multiple doctors with multiple modalities, and sometimes you see a little bit of a clash. So it's always a little entertaining when it comes to that stuff too.
Yeah. It's always a good, to have the neuroendocrine tumor from a different views and different subspecialty, and always the one who benefit at the end will be the patient.
Yes, absolutely. So real quick, we do want to know a little bit about you, who you are. How long have you been studying NETs? What field are you specialized in, and that kind of thing?
No, sure. So I graduated from Cairo University School of Medicine, and then I came here. I did a research fellowship at Emory for a couple of years, and then I joined Morehouse for internal medicine residency. After that, I had my hematology and oncology fellowship at Karmanos Cancer Institute at Wayne State University. Then I spent 1 year for GI cancers and neuroendocrine tumors at Moffitt Cancer Center. And then I came here and we built the program for neuroendocrine tumor at UH Seidman, which is also affiliated with Case Western Reserve University. So I have been in the program director for this program from 2019, so almost coming to the 4 years now.
That's amazing. Now, what in your medical journey, what led you to NETs?
So really, neuroendocrine tumors are very special types of patients. During our fellowship, I can tell you most of us did not see a lot of neuroendocrine tumors. So gaining most of the experience was actually at the last year of my fellowship, and then the beginning of the 2 years in my career. I found that treatment of these patients are really unique. It's completely different from other GI cancers. Most of our treatments that we use for neuroendocrine tumors are completely different from the treatment of other GI cancers as well. So the idea of treating, a unique patient with more like what we describe as a spider web, not just a first, second, third guidelines. No, neuroendocrine tumor doesn't really work like that. You need to have a multidisciplinary team. You discuss every case in the tumor board. Surgical oncology will have an input in some cases. Endocrinology, have input in some cases. Pathology are very included in our patients. So just working us together as a group was really fascinating for treating this type of patients. So treatment of neuroendocrine tumor has been a very great experience for me and my team here for at least the last 4 years. And that's really what made me very interested in treating this type of patients.
Yeah, that's amazing. That and now, did you necessarily go into what you did your fellowship? What did you go into the field knowing that you wanted to do a neuroendocrine?
So going into the field, most of us go as a GI oncology. You find most of neuroendocrine tumor specialists are also GI oncology in the same time.
Okay.
But during my first year of my career, definitely I made a decision that I would like to have most of my clinic neuroendocrine tumors. I still see some colorectal cancer every now and then, but now almost 90% of my clinic are neuroendocrine tumors. So very early in the beginning of my career, I decided that I would like to really specialize heavily in neuroendocrine tumors.
That's fantastic. That's fantastic. Now, you mentioned the spider web that is treatment of neuroendocrine. Why would you say it's important for patients to be involved with that treatment plan?
So usually when I discuss neuroendocrine tumor with any of our local conference here, I always tell the patients the first step when you have been diagnosed with neuroendocrine tumor is to find a program, not just a specialist. Because everyone in this program, if they treating a lot of neuroendocrine tumors, they will have an experience to deliver the most optimum treatment plan for you and to have hopefully better outcome for you as well. Saying that, just finding a medical oncology who treating neuroendocrine tumors may not get you the same result that you are looking for. You need to have a very good pathologist from the beginning who give you a comprehensive report about neuroendocrine tumors. You need to have a very good surgeons who are what we describe sometimes slightly aggressive. They can do what we call the cytoreduction for some patient, even in stage 4. You need to have an endocrinologist who can see the patient from beginning with you. Most of our patients will have some sort of hormone secretion, what we describe as functional neuroendocrine tumors. And definitely including endocrinology from the beginning will, improve their symptoms, will definitely improve their outcome. So you can see there are a lot of different subspecialty have to treat you as one team. So this is the most important advice, if I would like to give to any new patient with neuroendocrine tumor, is to find a program that they have a different subspecialty treating neuroendocrine tumors. They have a neuroendocrine tumor board to make sure that we discuss these cases on a weekly or bi-weekly basis. That's really will deliver the most optimum management plan for our patient. And this is the most advice. If you ask me for one advice to give for our patient, this would be my advice for them.
Yes, yeah, actually, that was going to be my next question. But back to the original, why do you think it's so important for the patients to actually be involved? Because I know that there are a lot of patients who kind of go, okay, doctor, so-and-so, this is what I'm going to follow, and that's it. But patients should be using their voice as well, correct? So what makes it so important that they're involved with it? I mean, especially with the different modalities. You've got your surgical. You've got your when it comes to like therapies, different types of therapies to slow the growing or reduce it, whatever it is. Why do you think it's so important for the patients to have a voice in that treatment?
So patient advocacy now is one of the most effective, type of influence in our patient delivering type of information in the era of the social media right now. So to have a patient advocacy group, you can hear from other patients what are their experience. They can educate you more about what type of tumor do you have and what type of care you should seek. I think that's very important. So it's the same equal important as the physician and the group of neuroendocrine tumors that they are going to treat you is to be included in a patient advocacy group to ask questions, as this patient already have been through all that before you. So they know all what's going on through the journey. They know how the experience should be. They know what type of questions he should ask. That's very important for all our patients to be included in that. The patient advocacy conferences is not only to increase awareness about neuroendocrine tumor. It's actually to educate our patients as well. Inviting different subspecialty from different states, have different type of experience in the neuroendocrine tumor program, will give the patient more type of information, more confidence about what type of treatment they are seeking, what type of outcomes they are looking for, and most importantly, to educate them about type of cancers they have, given that neuroendocrine tumors are completely different from any other cancers. So yes, definitely patient advocacy is as the same important as choosing a good program for neuroendocrine tumors.
Absolutely, absolutely. Now, to the people that are listening and watching, there may be people who aren't near a a uh, a center of excellence when it comes to neck cancer. So, Iowa, Cleveland, Kentucky. We've got Aman Chauhan working in Miami, Florida.
Yeah.
If they don't live in those areas, what is your best advice to them and on how to approach this and try and get involved with a center of excellence?
So most of us as a neuroendocrine tumor specialist, we do work with local oncologists as well. So you may start with a local oncologist. I think it's always healthy to ask for second opinion. So I usually encourage this patient to have a second opinion to find who is the nearest center of excellence or who is the nearest. We don't need to name it as a center of excellence specifically, just let's say a neuroendocrine tumor specialist program. So if you can find a program like that or a specialist nearby you, you can always have a second opinion. And most probably, most of us are willing to work with your local oncologist as well. Because sometimes when you are diagnosed with cancer, it's also a lot of stress to going back and forth if the specialist is really far from you. So I think it's completely fine to introduce your local oncologist to the specialist that you seek the second opinion from, and they can work alongside well together and, have a specific, management plan for you to make sure they are all in the same page. So you don't need to see a specialist every month. You can see your local oncologist every month, but you can have a specialist who follow up with your plan and always talk to your local oncologist to make sure that you do everything according to the guidelines and to the new types of treatment we offer our patients.
Now, what I will say is, from when it comes to a neuroendocrine based center, you guys are all super collaborative. When it comes to, I've been to 20 years worth of conferences, and it's very much a family. It's everybody collaborates, everybody shares ideas, that kind of stuff. It's really, really awesome. So, for a patient who gets any kind of pushback from their local oncologist, who may not be familiar with it, who may not know as much about working together, it's a true collaboration. What is your best advice to that patient to
So my best advice for this patient, even between the neuroendocrine tumor specialists, I share a lot of patients with my colleagues as well, going back and forth. I always, if the patient I feel that they are seeking maybe different opinion than the one that I gave them, I always encourage them to go to a second opinion. And I provide them with the name of the specialist nearby that they can still go visit and have a second opinion. I think for every physician, if we just take it friendly, if you talk to this local oncologist and try to describe to him, you are not taking the patient from him, actually are working along with him, and he's still seeing his patient as his own patient, but we're just collaborating together. I can see most of the physicians take it friendly if you approach them by this way. Because, at the end of the day, we both are working for the sake of the patient to make them feel better. My advice, always try to talk to your oncologist about you would like to have a second opinion, and not that you're not trusting him or you're not trusting his medical knowledge. It's just basically to have maybe more options that maybe this cancer center will have that he's not have it at his cancer center or at his private group. And also I advise, myself and other physicians that we always seeking a second opinion, even between each other. I send a patient to one of my colleagues, have a specific clinical trial that I do not have it here at my institution, and vice versa. So collaboration is between local oncologists and neuroendocrine tumor specialists, and even between neuroendocrine tumor specialists between themselves. We do that all the time. And if you reach it with a good manner, friendly approach, most probably it will work well.
Yeah, and that's to your point, the neuroendocrine tumor board, that's a weekly collaboration between doctors who are looking for other opinions, other ideas, other people to bounce things off of. So that's why I think this community is like just super special. It's super special.
You're still paging me sometimes, so I'm really sorry about that.
No worries. That's what makes this super special, this community. So I appreciate the advice for the patients and all that. I think it's really important to definitely definitely seek out specialists. And yeah, like you said, definitely talk to your doctor, local doctor, about collaborating. Not
Yeah,
necessarily going, I want to go to them instead.
yeah.
Bring it up as a collaborative process.
That's right. And I can tell you, we actually in our neuroendocrine tumor board, we're inviting a couple of private groups and community hospitals to attend our neuroendocrine tumor board, so they can present their patients as well in our tumor board. They still can keep the patient. They can take the advice from us. Maybe I see the patient one every 3 to 6 months, but I still see the patient and follow up with them regularly. So we're still definitely working as collaboration with each other more than just competition or taking the patient or anything like that.
And your tumor board is not necessarily just your practice, like you said. It's nationwide.
Yeah.
So
There is some agreement has to be done between this institution to make sure that you follow everything according to the
Sure.
HIPAA regulation. But at the end of the day, that's something possible. You can do it with some of the places maybe does not have a same neuroendocrine tumor board.
Absolutely. So, Dr. Mohamed, before we wrap up, we're really excited for Cleveland. Again, you are the anchor for our program. Why do you think it's super important for patients to attend this particular event?
So in a personal level, I've been really enjoying NCAN for many years now. You guys doing a unique job by collecting all the specialists from different states, from different subspecialty. You always have a variety of presentation on different topics for neuroendocrine tumors, and most of them are very patient-friendly. So the patient at the end of the day gaining a lot of information about how to advocate their care, about what type of surgeries they should ask for, what type of pathology reports they should ask for, what type of specialists maybe they need. And usually the regional one at the state that I attended a couple of times as well, you inviting different subspecialties. So the patient will come and have a comprehensive knowledge about neuroendocrine tumor from different specialty. So he will hear a medical oncologist about all the new treatment for neuroendocrine tumors. He will hear the surgeons about, when to seek surgical second opinion, when to have a surgery, even if they have a stage 4 cancer, when to have a surgery for local type of tumor. They will hear, in the endocrinology standpoint, what type of treatment they should be to control the hormonal secretion. So again, they will hearing a lot of variety of medical knowledge from different angles to cover all what they need to know about neuroendocrine tumors. So I really encourage my patients and all the patients that are hearing us today to attend the NCAN regional and the annual conference as well.
Yes, thank you. Thank you so much for the kind words, too. We know that you are going to be covering medical management of NETs, the current and future methods. I'm really looking forward to the future because it has taken huge strides in the past, 3 or 4 years. So really excited to see what your presentation comes out like on September 9th at the DoubleTree in Cleveland downtown. Once again, thank you, Dr. Mohamed, for joining us. We're really excited for our conference that we have coming up. We do have on September 8th, the night before the conference, we do have a meet and greet that we'll be doing. So if you're in the area, feel free to come by and come hang out with us. Registration is open. netcancerawareness.org. You'll find out all about all of the doctors and the presenters that we will be featuring on this particular conference. Stay tuned. More information coming soon on all of our social medias at NetCancerAwareness, at NetCancerAware, Facebook, Instagram, Twitter, and LinkedIn. And thank you all for listening to Nets Get Real with NCAN, and we will see you next time.
Thank you, Mike, for having me on.